Hello folks, how you guys doing again? Once again, this is Dr. Kunelis, and I'm going to be joined with me today by my favorite chiropractor, Dr. Heyer. And last time, if you recall, we left off talking about base of occiput, C1 and C2. And if you recall, we had talked about how distortions in the lower jaw, as well as distortions in the upper cervical vertebrae, can lead to pinching of these little tiny structures and nerves in the cervical vertebrae. So what we're going to talk about today is basically how do we take all these theoretical concepts and apply them to daily practice into the real world, which is really what matters. We can read about it all day long in a book, but at the end of the day, if we can't get people out of pain and where the rubber hits the road, apply what we're learning, it makes no relevance. So what we're going to look at right now is this person's bite. And looking at it, conventional wisdom would say that everything looks okay from the standpoint of teeth being straight. And in reality, it actually does align pretty well. The only problem is with this young lady, she's been a chronic head pain sufferer for the last several years. But upon closer evaluation, we're going to get a chance to look at how the upper teeth align. And when you look at the lower jaw and the lower teeth, you'll be able to notice that the midline of the lower is actually off to her right. But more importantly, beyond that, you can hardly even see her lower teeth. So in this condition, when we look inside her mouth, we can already assume that that bite is overclosed. And when that bite is overclosed, what that means is those muscles that are contracting to let that bite come together, those muscles are at a shorter length, much shorter length than what they genetically should be. So what's our goal in therapy? Our goal in therapy is to realign that jaw position, what we call that mass damper in the building scenario, in the large tall building. We want to realign that jaw position in a way that is communicating with the head, which is attached to the upper jaw. The upper jaw and the head are the same component. The lower jaw is a free-floating and three-dimensional space. We want to make sure that that lower jaw, the head, the shoulders, and the hips are in relation, are in balance. So what we normally do is 2 months of therapy. And I'm not going to show the therapy here. But what I do want to show here is the final registration of where this patient's bite is and where the jaw should be in an orthopedic posture, the correct posture in relation to the head, in relation to the upper teeth. This is this patient's correct jaw position. Now when you look at this correct jaw position, a funny thing happens when the orthopedic structures are aligned. You can see the cosmetics are much more in line. After 2 months of therapy, and that therapy includes chiropractic adjustments, don't forget. We're not looking at only the jaw component. We're looking at the component of the head, the shoulders, the hips, the pelvis, and how our chiropractic treatment during this phase of finding the lower jaw position, how that all comes together as one. And when that comes together as one, this ultimately is this patient's correct orthopedic position. Obviously, we have to have the patient being able to function without two pieces of blue material stuck between their teeth. So what we do for the patient is we actually make them a clear splint, or what we call orthotic. Now again, if you look at the orthotic, it's clear. It can be worn and functioned with. You can even eat with it on, believe it or not. Getting to talk with it takes a couple days, but the tongue gets used to it. And ultimately what's happening is the lower jaw is being supported by the orthosis in the correct, what we call neuromuscular position. So let's take a look at this position. Obviously, the muscles of the face, which are attached from here to here, one can see that obviously they're going to be longer than what they were when the jaw was overclosed and short. When the jaw in this patient was overclosed and short, a couple things were happening. The muscles were hypercontracted, shortening to make that position hold. With those hypercontracted muscles, what are we getting? We're getting a lot of lactic acid buildup in the muscles. We're getting poor oxygenation to the muscles and poor blood flow to those muscles. On top of that, that poor jaw position with those hypercontracted muscles is causing other distortions in the head and neck, specifically C1 and C2. That's all happening courtesy of the poor jaw position. But when we look at the poor jaw position, we know that as we try to find that jaw position, things are going to be changing. So we call upon the chiropractic profession to help facilitate those changes in therapy. And when we facilitate those changes in therapy, we're able to get to a final position that is very, very harmonious with the body's neurology. In other words, the muscles are in a position where they're not stimulating the nerves to continually send this information to the brain. Constant feedback and bells and sirens and busy signals to the brain, which the patient ultimately perceives like as pain. So this patient came to see us with pain, and now she's out of pain. We have the same thing that takes place in this patient. This is the exact same patient. The exact same patient in the first scenario here with an overclosed bite, and after physical therapy, chiropractic adjustments, and orthodontics, this is ultimately the patient's final position. And again, look what happens when we align posturally the orthopedic structures. We align things orthopedically correct, and the cosmetics seem to fall right in line. So what I'd like to do is leave it at this point so everybody can get an idea of the differences in length of the muscles here when everything is more closed and short versus more open and correct here. And next time, Dr. Heyer is going to close out for us and wrap all these concepts of prevalence and everything that we've talked about so we can get a good, clear picture of how this problem isn't an individual problem, but also society's problem, which is what we learned in previous slides on prevalence. So we'd like you all to tune in, and I thank you for tuning in this time. Thank you.